All right, here's where we start for you on all angles this hour. One inmate has died and 8 others have tested positive for diphtheria at the Pollsmoor Correctional Centre in the Western Cape. According to the Health Ministry, the deceased 19-year-old male showed symptoms at the end of October and was referred to a hospital. Immediate contacts of the patients and the deceased have been put in isolation to prevent further spread of the disease. Let's hear more now from Correctional Services Spokesperson Singabakho Nxumalo. Thank you so much for joining us here on eNCA. Just firstly, when did you start hearing about this issue that's now arisen at Pollsmoor?
Good afternoon, and thank you for having us. What was brought to us was a very peculiar case where you had an inmate who reported not feeling well, was treated internally and transferred to an outside hospital. It is only then when we received a report that this inmate was suffering from diphtheria and was moved even from the initial hospital to then Groote Hospital. And when the laboratory results came back, they indeed confirmed diphtheria, because I think what may have confused the healthcare professionals in this case is that the symptoms, your fever, sore throat, swollen glands, was something which, ordinarily people will get when they are not feeling well. So, but then the laboratory confirmed results then at least alerted us to say we're dealing with something even much bigger. Hence, we needed to start with now contact tracing and also testing other inmates who were also not feeling well. And out of that, we then confirmed that we have 8 cases. Unfortunately, the first case, which we call an index 1, passed away on the 5th of November. So that's where we are now. We have, in a way, localized, made it a point that medium A at Pollsmoor, we restrict the movement of inmates there, also of our staff members, so that we do not make it possible for the others to move from that particular facility to another site. I'm sorry about that.
It's okay. So is it only 8 inmates still? Is the number still 8 in terms of those who were infected as well?
For now, that's the number that we have, but we do not want to leave anything to chance. Those that we've confirmed to have had a contact with the index case have been isolated, and a number of them have also been subjected to a test. We're waiting for those results. So that number may increase if perhaps some of them do test positive. But it was important for us to say, let us make it a point that we limit the movement there. Those that are not feeling well do receive treatment, but also the Department of Health came in and said, no, we can definitely assist even in terms of the vaccines, because there is a vaccine that is able to deal with diphtheria. So we have started with those, especially with those considered to be at high risk. Here I'm talking about inmates and our officials, because contact tracing does involve our officials as well, because they work with inmates.
Now, what about overcrowding, Singabakho? Because this is also another debate about our prisons, and an outbreak such as diphtheria could also expose that.
The reason why it's important that you contain the virus wherever it is, or whatever illness, is because of the nature of correctional facilities. The design is that they become highly concentrated. So your prevention measures must be designed in a way that you try to limit possible movement, to make it a point that you avoid cross-transmission, and that even the level of awareness, both by inmates and officials, is also high, so that people do not leave the facility and go wander around and then spread the disease. So you limit that, and you also make it a point that required protective gear is also available, so that you can protect those who could be coming from other centers. What we're also looking at was to say, this is medium A, which is an admission facility for remand detainees, to say, how do we then make it a point that the section or the unit where where the 8 are, then does not come into contact with other units, meaning that even people coming from court are not taken to that, or taking people even to other facilities that we have inside Pollsmoor, but also even raising awareness to other facilities in the country because of the numbers that we have and how easily diseases can spread in that space, be it communicable or non-communicable disease. So we must always be, alert to that as a department. And we've learned a lot from COVID-19. So at least when we said, let us go into deep cleaning, our officials understand that. When we say, let us make it a point that we isolate people, they understand what is that. Early treatment for those that have symptoms or those that have tested positive, they also understand what it means and why it's important that they isolate themselves.
All right, and lastly, among the 8, Singabakho, on this particular topic, among the 8, are any of them correctional services employees, or is it all inmates?
At this point, what we have is it's inmates. Okay. Hence, we've said to officials they shouldn't take things like the moment they feel that they're having symptoms. One may say even if it's like flu-like, do not leave anything to chance. You ought to stand up there and there because containment is key. So, but we said all the officials who came into contact. So in all, it's 74 people whom we've identified as contacts. And then said all those people, they have to look after themselves. And when they're not feeling well, they need to indicate to us. Out of that 74, 55 of them are inmates, only 13 officials. So you can see where we are. And even if it's 13, we do not want to take it, for granted. We have to say even to those officials, limit your movements and make it a point that you are cleared of any possible danger, then you can continue with your business. But again, early treatment here is key. There, I'm also referring to vaccination. Department of Health is assisting us in this regard.
Okay, just one more question of clarity, Singabakho. Of the 74, is that 74 in isolation?
What we've done, the 74, we said they need to isolate themselves. So with inmates, it's easy to isolate them because you put them in the units where they do not come into contact with other inmates who could be coming from other sections. With officials, they have to isolate their places of residence. And we said to them, whenever you are not feeling okay or when you start to develop symptoms, please do report so that, you could be, given necessary medication because there is medication that can, assist you, but also the issue of testing is key here so that you are able to be treated at that early stage without having to wait until it's late where you find that there is little that healthcare professionals can do to save your life.
All right, thank you. Singabakho Nxumalo, the Correctional Services Department spokesperson.